This is Dr. Cottrell, and this is arthroscopic rotator cuff repair. What we're going to do is see some actual arthroscopic pictures of the inside of a shoulder and then move on to the video of the repair in this patient of mine. Here's the arthroscopic view of the inside of a right shoulder. On the left side you see the socket, on the right side you see the ball in each of these pictures. This shows the rotator cuff tear, and you can see the torn cuff on the right side there. This is looking up at the ball. Here's looking at it from above. You see the tear and the gap, which is about to be closed when I move the cuff over, as you can see with this special instrument. Next you'll see the actual video. Here is the hole I've already drilled, and I'm inserting what we call a suture anchor, which is a little absorbable screw with some stitches attached to it. This was actually the second anchor in this case, but for these purposes, showing you how the anchor goes in. Then the screwdriver will come out, and then in the next clip you'll see how I pull the stitches and pass them with a special instrument that I use in this case to pass the stitches into the rotator cuff from underneath through the top, and then retrieving them with that grasping instrument. And I'll use this same technique to pass each stitch that I want to pass through the rotator cuff. The blue and white stitch is one stitch that slides through the anchor, and you'll see how I later tie the stitches. In this case, the white stitch is only passed one time through the cuff in a similar fashion. Next you'll see how I actually tie these stitches down, which pulls the rotator cuff over to where it's supposed to be. In this case, it's actually the third anchor I've placed. I've already tied the other stitches, but you see how these stitches get tied. They're tied outside the skin, and then I slide the knot down into the joint, snugging the rotator cuff where it needs to be. Tie an additional few knots, push the knots down with a special instrument to tighten them and secure the knot inside the joint, as you see here. And when I'm done, there's a special instrument that clips the end of the stitches. I'll do the same thing for the blue stitch. Again, sliding my initial big knot down, additional 2 or 3 knots securing it. Actually not shown here, but then clipping the stitch. And now the cuff is repaired. The gap is no longer present. As I rotate the arm, you can see how the cuff moves with it, and it's got plenty of room. Here's a picture of what the skin looks like outside after the completion of the procedure. You see very small incisions, which are each closed with one stitch, leave very minimal scars. The important thing is that the repair has been done, it's secure, and the patient can start moving right away and have a predictable recovery. Thank you very much.